I'm Dr. Jim Wiley, and here with Dr. Bruce Rippey. We are at Bridge Integrative Medicine in our First Impressions room.
Yep.
Like the bridge in back of us there, you know. So we're creating a little bit of, in fact, a bridge from where life was before to this. Here we are in this COVID-19 life, and what life looks like going into the future, even currently, but also how we transition Bridge Integrative Medicine during this time. And we've been talking about hunkering down to rise again, and then also having the mindset of this is a great time to grow. So I thought maybe we should just, in real practical terms and for our patients, talk about those two aspects and how they are manifesting themselves in the practice today.
Sure. Yeah.
Tell me a little bit about in the area of growth. We've talked about this now quite a bit, but it feels like this is a time where everything's kind of buttoning up and waiting for the hurricane to pass, and yet you're talking about growth. So how does Bridge grow, and what does that look like for our patients right now in the services that we are doing or will be doing very shortly?
Yeah, so the innovation, of course, is we are allowing exosomes to come into Bridge. We've been doing regenerative medicine for quite a while, being able to discuss the right way to use immunomodulatory and anti-inflammatory regenerative medicine for supporting an immune system. Mm-hmm. And we know we have it. We know what we have is gold. Every time I'm seeing it, I'm the guy that's looking at growth, right? So I'm looking at innovations every day, and I go to places like bioinformant.com and exosomes.com, and I read all of what they're actually doing out there that's working really, really well, and why it's working well, and the science behind it. But we're very careful not to promote it till we know the science behind it. And then I'm also very careful not to talk about the science behind it because it gets boring very quickly. But yeah, so that's what we're doing. We're actually
calling
growing
this like an immune booster.
Yeah, the immune booster. You know, stuff that's been around with IV therapy for a long time has been excellent. It's why it stayed around, even when there were, I don't know, haters. You know, they just said no, it doesn't do anything, and it was like, actually, yes, it really does. And so we have that here. And then certainly we have advice for people, and then we have the IV therapy is everything from the vitamin mineral compounds that we have, plus the exosomes that are safe.
Well, what about the patient that doesn't necessarily want to leave their home, but they might need some consultation?
Well, you did all that work, man. We're growing the telehealth, which was unbelievable that you could get all of that. So we got the telehealth now where we can do those telemedicine things. The doctors have allowed, our directors of medicine have allowed our nurse practitioners to now get into the homes themselves. That's another thing that you worked on. I can't believe that. That was amazing. But all of this stuff became, ideas, but they became innovation that came true, right? So we were able to do that now. So we're now able to have our patients call us and say, hey, I'd like to stay home and I'd like to chat with you. And we allow that to happen now. It's a lot of work, the platforms, but you get it done. And then once that gets done, we're able to offer the services that we would be able to do. You had them start doing some of the things like in the parking lot where you would actually connect with them and say, hey, text us when you get here, let's chat. Of course, all of the sterilization and aseptic technique and the sanitation and the stuff that we've done and applied here is above CDC code. So that's been wonderful. So you're in a safe environment here. I mean, this is really good for all the COVID stuff.
Right. Patients all walk in and go, it smells so fresh in here.
Yeah, does it ever? But it smells sterile to me. But I think it's important.
It is. We're doing all the little things like wiping down a credit card or wiping down a pen if a pen is used. It's all of those kinds of things. We went in and had all the carpets cleaned just recently to make sure we do that. And of course, all the doctors, all the caregivers are washing their hands and using the sanitizers. And even after patients leave, we're wiping down all the tables, wiping down all the chairs so that the next person comes in can come into a nice, safe environment. Because quite honestly, there are people that either need to or want to get out of the house, but they're coming for an essential service, and they want to be able to come to a place that is following all the guidelines, and they feel safe. But they actually, I think, in some ways, mentally just want to get out of the house for a moment or two.
Yeah.
And so, while everybody else is hunkering down, we still want to create a space for people to come.
Exactly. There you go.
To deal with their aches and pains and their problems. Because honestly, who wants to, even in the midst of all this, right? All of those things still occur. We're sitting too much. We're in front of a computer doing this, because we're trying to work from home, and we end up with really hurting ourselves. So we're trying to keep the doors open.
What's the number one reason people go to the ER?
Yeah, it's back pain.
Yeah, number one. Yeah, it's unbelievable.
Yeah.
And then migraine or headache follows that one as number two.
Right.
So, and we fix that every day. That's what we do.
That's what we do.
Well, what's the number one reason people would want to avoid the ER today?
Right. Well, they don't want to get the medications, or I'm sorry, they don't want to get the exposure to these things.
Exposure.
If
there's a
they're
risk
in other rooms with other people. Right?
Yeah. So, I mean, we are the place to go for that, and that needs to be addressed. People, but we could absolutely set it up with: do you need to come in? Are there stretches? Are there things? So the innovation of that is we could chat with them first, if they're interested in that.
Sure.
And this goes for friends and family. Most of you that are seeing this are patients, right? But your friends and family, it's the same thing. Have them chat with us, telehealth first, right? They don't have to leave their home at all. And then we would get the opportunity to go, okay, this one does require some hands-on moving, and we'll do that for you.
Right.
Sometimes it's a brace. I mean, you've set that up beautifully, where we might be able to send them a brace that would help them get through if they had the appropriate exercises to do while they were braced.
Sure.
You can't just throw a brace at it. People have tried that forever. There's how many of these things are on infomercials, but they don't work that way. You actually have to do something with them.
Right.
But if you do, they can be at least partially effective while they're hunkering down.
Yeah, and honestly, one of the neat part about all this innovation is that one of my patients has a sister in California, really suffering, hurting a lot right now.
Yeah, I remember that.
And so I was able to call and we're going to arrange a time for me to visit with her, and perhaps we can get her something that she can like a brace over telemedicine. So there are some neat opportunities for us to go beyond these four walls.
That's the innovation part of growth.
Right.
That's what you're talking about.
But if people need to come to the four walls, we have that here and made that safe for you. So So anyway, thanks for the opportunity to talk to our patients a little bit about these ways.
Yeah, it's for you. It really is. We do this for you. We make sure that we come to work for you. We realize that a lot of times you're staying home for us. If you're sick or you've got a bad cough or something like that, that telemedicine is not a bad thing. You can call us. We can connect with that. We can find out what you're doing. There's a lot of symptoms that occur in this particular time of year that are going to seem similar, and they're not. There's a big difference, So in fact, the COVID-19 virus rarely has a runny nose. Did you know that?
Yeah.
It rarely has a runny nose, so you can always kind of look to at least pieces of that. But there's a lot of pieces of information like that let us dial down into what's going wrong.
That's right. So we're here to help. That's the big. However it is that we can help, we're positioning ourselves in such a way.
So what would they do? What's your next action step? Let's say grandma that's never been to us wants to have an idea of how she's doing. What would be the next action step?
Well, I think the first thing is just call our office,
that's
and then we will determine from there how best to connect with that patient. It could be through telemedicine, or and every situation is different. But we have enough methods or options, I guess I should say, for patients that we can certainly
Don't
find a
they
way
call
to help
that
them.
bandwidth now?
Yeah, it's bandwidth.
Yeah.
There you go.
I don't know.
All right. Well, thank you, Dr. Bruce, and we look forward to serving you in every way we possibly can.